We have Nancy with us today. Nancy is 42 years old. She's been a patient for almost 2 years and has been on testosterone for that long. And why don't you tell us what was going on with your life before we started on testosterone replacement?
Well, Barry, when I first met you, I was talking to you about that I was depressed, and I was severely tired, fatigued, and that wasn't feeling too well, about what, my life or what was going on.
What do you mean by that exactly?
I was really not in a job that was good enough for me. It was just a job that was paying money. I had no pension, no medical. I was depressed about that, and really just felt like I was in a hole,
Spinning your wheels.
Yeah, not really making, doing the best I could for myself.
There was also some anxiety.
Oh yeah, I just well, because if you don't have a pension and you don't have medical, of course you have anxiety about what's going on with your life. I mean, you're 42 years old, and I wasn't married. I'm not married, and I had nothing. You shouldn't have. You really shouldn't not have medical when you're 42 years old. So
right.
It was very depressing. Of what was going on at the time.
And you weren't able to motivate yourself to move on to something better?
I was lucky I was getting out of bed.
Because of the fatigue?
Well, because of the fatigue and the depression. I mean, I would find an excuse. I'd get up, I'd do a few things, and I got to go home. I just had to take a nap, or I had to go lay down. I wasn't participating in life.
Okay. And no sexual problems, though?
No.
You never had any problem with your libido, etc.?
No.
No. Okay. So then, almost 2 years ago, we started you on testosterone replacement, because we did a blood test, obviously, and that was low. And so what happened with the testosterone?
Well, you started me on the therapy, on the testosterone therapy, and you told me about the side effects that I might have, and one of the things that you brought up was that I might have hair growth, which scared the daylights out of me. But it didn't scare me enough not to take the testosterone, because I really wanted to help myself.
Right.
So, and which the hair growth that was what I thought, I was thinking of like a male, and it did not turn out that way. It's as minimum as eyebrow waxing for me. So, but you had to tell me the side effects. So, and then, I don't know, it wasn't a quick fix. It took a while.
What did happen?
Almost like there was a light, like light came back into your life, life got a little lighter. Things weren't as heavy or as complicated. You know what I mean? It just, I was able to sort through the daily stuff, instead of sitting with it. And I don't think it happened overnight, it was just...
How long did it take to happen?
When I look back on it,
yeah.
Probably the new year.
About 4 months?
Yeah, about 4 months it happened.
So you were thinking more clearly, more positively?
Oh, with the no doubt, because I was able to get into a job market, that I took a test, and I was able to get a really good job now that brings me medical and pension. But like I said, it was not something that I was aware of. Now that I'm looking back at the progression, I can see it, but it's not something that I felt. Yeah, all of a sudden you start feeling better, and then you looking at the depression and that your anxiety and stuff, and when that starts to lift, you're able to look and focus at your life, and say, I got to fix this, and you start using the tools that are available, and you're able to. And taking a test which you need a clear head to do, of answering questions, and just making certain that you're taking care of everything. And that's how I felt about it. When we talked about it, about the months that led up to it, I can see it, but it didn't feel.
It wasn't so clear while you were living.
No, exactly.
Much clearer in retrospect.
Right. It's like reading a book now. It's like, oh wow, that's because of this happened, and that happened, and this happened.
Well, what specifically happened with the fatigue?
I don't have fatigue unless I'm tired. I'm done with the day.
So what you had was gone in that respect.
Oh, absolutely.
And the depression?
None. I'm happy. I'm really thrilled about life. I really am.
And the anxiety?
That's gone. That's gone. And the testosterone that we started with has now declined.
You're on a smaller dose.
I'm on a smaller dose
now.
Much
smaller dose.
Yes. And now it's just like a maintenance type of thing, as I feel about it,
And I remember you telling me when you got your current job that you never would have got it without testosterone.
No doubt.
No doubt.
No doubt. No, absolutely. I wouldn't have had the confidence to even take the test. And what I do now, you have to have a lot of confidence. I work with, you have to have a lot of confidence.
Okay. Well, I'm glad you have it, and your self-esteem obviously came up along with it.
Yes. Yes, and I thank you, Barry, really.
Oh, my pleasure. I'm glad to see things like this happen. I wish it would happen to everybody who needs the testosterone. And once again, how would you rank the amount of facial hair growth?
Oh, to eyebrow waxing, That's it.
Nothing more than that.
No. And it's only on the chin. Really, it's nothing for me. Just for me, nothing around the cheek area or anything, just on the chin. And I don't find it a problem at all.
Okay. Well, thank you very much for doing the video. It's really a great story, and you did a great job.
Thank you,
And
Barry.
I want to thank you.
Thank you.